Earlier we mentioned that the scissors are made out of flexible steel, and the scissors are crossed with a 300% increase in shearing angle, and they cut more efficiently. Now, another benefit of that is that they always cut on the point. Now, this particular scissor is excellent for removing sutures that are buried. Now, if a suture is buried, and this happens many, many times in implantology, in endodontic surgery, periodontic surgery, where the suture will become buried by edematous or hypertrophic tissue, like this. Now, normally, the dentist or surgeon will have to give a local anesthetic so that they could dig the suture out. But this scissor is special. Number one, it is so light that it's lighter than titanium, not because the density or the specific gravity is less, but because we've taken advantage of some very basic engineering principles that allow us to use half as much material. Now, on a normal titanium instrument, this thickness would probably be about 3 millimeters. Here it's 1 millimeter, but we've added convexities and concavities to add beam strength to the instrument. That makes the instrument light, and the tactile sensitivity is extraordinary, such that when you close it and feel the suture, you can actually feel the suture. And this is very important because with this particular technique, you will be removing the suture by tactile sensitivity rather than by visualization. Now, if the suture is buried, like this, take the scissor, and you want the angle of the curved scissor going downward because you want to approach the suture perpendicularly at a 90-degree angle. Close it and go back and forth to feel the suture. And when you do feel the suture, it can be demonstrated very easily because you'll actually feel a little bump. Once you feel that little bump, center the scissors on top of the height of the suture. Elevate it ever so slightly for clearance and allow it to open. The blunt blades will gently separate the edematous borders like this, and you make sure that the scissor blades straddle the suture so that there was one blade on one side of the suture and one blade on the other. Re-advance the scissors and cut. Now there's no damage to my finger, and the suture is cut. This is done painlessly to the patient. Otherwise, the local anesthetic would have to be given, or the suture will be just dug out. This is our most popular instrument worldwide. We sell more of these than anything else.